Hi, it's Dr. Rudy Kachmann. Welcome to our wellness show. I have a guest with us today, Dr. Mahtab Ahmed here from Ohio. He was an expert in weight problems and diabetes. It's going to be a wonderful show. This may give you some information. You may have it. You may be undiagnosed, for example, which many patients are. So I like to point this out to you. Is blood testing. We all need blood testing. That's very important, especially if you have family history, you're a little bit overweight, but also we have the trophies. They're thin on the outside, but fat on the inside, fatty liver, and they can have diabetes. And the good news is we're going to put out today that's type 2 diabetes is mainly what we're speaking about. You can get rid of it in about a month, maybe sooner than that, a proper lifestyle. This is based on science. I'd like to show you two books because I'd like you to do some additional reading. End of Diabetes. Did you hear that? End of Diabetes by Dr. Joel Fuhrman. I know Dr. Fuhrman well. And I learned something about this book today. Dr. Ahmed, would you tell the audience what I learned today? About that you can get this.
Oh, okay.
Yeah.
So this is a book. You can get that through the Amazon. You can download in your phone. And there are two versions of this book. You can get the full book and you can get a summary. Summary is about 20 minutes, which is very good when you're driving. You put that on the phone, you can listen. It's very easy way to download, and I'm not phone savvy, but I was able to do it without the help from my kid.
Yeah,
so
yeah, that's fantastic news. I mean, in 20 minutes, you can learn how to go to type 2 diabetes in a month.
Yeah.
Gosh, that's associated with what, 50 diseases? We decided.
Mm-hmm.
50 diseases: heart attack, strokes, blindness, dementia, amputations, liver disease, renal disease, skin rashes. You can get rid of it. Don't just accept the script to the ill. Get rid of the disease. The complications are too high. You want to live to be 100 and be free of disease. Is how you do it. If you do that, you will probably add 25 years to your life and avoid 35 years of disability. That's based on statistics, okay? But you need some more information that we're going to give you today. And I think Dr. Fuhrman's book, and download it, and if you don't want to read, just while you're driving, listen to it a few times, and you're on your way to recovery. Isn't that wonderful news?
Yeah, you can get in 2 days. Just some people like to hold on the book, which is very good.
Yeah, you can get it from Amazon. And, if you have this disease, I'd get the book through Amazon. 2 days, you got it. And that's that's one of your Bibles, okay? Another good book to read, which you're coming from, is excellent, is Goodbye Diabetes, Dr. Wes Youngberg, okay? Dr. Wes Youngberg was in the island of Guam, which had been flattened by the Japanese, and the natives, who used to eat nothing but fresh vegetables and fish, and they looked beautiful, just like Columbus. Remember, he found natives that were more beautiful than anything in the world, because if you eat, there's symmetry in the food that you eat, and you look like that. Yeah, remember he described these really beautiful people, and of course they most of them died because they get the viruses and chickenpox and what else, measles, when they had no immunity against those. But so he went to this island. For 15 years he was there through the Almond Society. That's from Utah, missionaries, and he taught them how to diagnose type 2 diabetes very early through early testing, and how to eat properly. Designed a method of testing which they use at Kaiser Permanente now, the path to diabetes, checking the blood sugar on the rise. To him, a normal blood sugar is about 85, okay? And then as it rises in pre-diabetes, the trouble is, even in pre-diabetes, you want to get rid of the disease because all the complications of diabetes, which I mentioned a few already, can occur in pre-diabetes. They can even occur before that in something called metabolic syndrome, okay? Metabolic syndrome. How do you look at it? What to you is metabolic syndrome?
There are different definitions, but number one is waist circumference. Number two is elevated blood pressure. Number three is maybe elevated cholesterol, which is the triglyceride. And next is low HDL, is the good cholesterol. So if you have three of them out of five, we can call that as a metabolic syndrome.
Oh, thank you. In other words, that's to catch you on the path even before prediabetes, which is HbA1c. That's a blood test that catches 3 months of your blood sugar from sort of 5.6 to 6.4 or 7 or so pre-diabetes. Some people would say 7. I think you say 7 occasionally. And then you're considered diabetic. But the darn trouble is, even in before pre-diabetes or in pre-diabetes, people can have an unannounced heart attack, no angina, no warning. They grab their chest, they fall over, and they're dead. Yeah, that happens. And so that's the reason we are for blood testing. I always say people, well, you are what you eat, sort of. You are what you digest, maybe more so. And then now I'm saying, you are what your blood work is. Okay, again, to a point, now that I've given the talk on vascular disease, I'm actually saying you are what your fitness test is. After all, that's the airplane that's flying now. You get the fuel and the wings and the tail. And so the blood test determine who you are. Really, so early testing, put it on a graph, catch it very early. And a good way too, we spoke about that, we spoke about vascular disease, is to get an advanced lipid test, right? Where they check the type of fats you got. Because the big LDL isn't as bad as we thought. It's a very low density LDL, particle size, particle number, that determine how much vascular disease you're going to get. Now the HDL, the garbage collector, the heavenly cholesterol, which should be high, not low, they've broken that down into HDL2, HDL3. 3 is the bad one, 2 is the good one. So we're breaking it down further in advanced testing. But what we're trying to do, catch it very early on the path so you can avoid diabetes. But we're saying, though, in the show, you look at it, we're saying preventing. Okay, so we're speaking about. But once you got it, you start eating the nutrient way of eating 78% of the time. Well described in Dr. Furman's book. Maybe 20% organic meat. For example, don't have to cut out all meat, okay? That you be rid of your diabetes, matter weeks or months, maybe a month. Actually, Mark Hyman, I have his DVD at home, Blood Sugar Solutions, Mark Hyman. I have his DVD at home. He says your blood sugar will be normal if you eat this nutrient-dense way, exercise, half-hour a day, 1 week. 1 week, you'll have to tell your doctor you're doing this because your blood sugars will drop quickly. You need to test more often, just for a few weeks, so you don't go into a hypo, too low blood sugar, because that can be deadly. Hyper, not as deadly, but also can cause confusion and dizziness. And if you're driving, it's a problem. If you're a truck driver and you go at the truck stop and you eat some not too good of food, you're driving down the highway, your blood sugar, and most of them are pre-diabetic because they're overweight. They're pre-diabetic. If your belly waist, remember we spoke about that, you get a pot belly, you're pre-diabetic or diabetic. I hate to tell you that. It's a judgment-free zone, but it's the truth of the matter. So, and you may have to push your provider. He may not, he might just hand you a script instead of saying to you, if you lose about, 8-10% of your body weight, Dr. Ahmed, your diabetes will be gone.
Right.
And it's quick. And your blood sugars will return to normal very quickly. That's the reason you got to check more often, notify your provider. You may even get off insulin. Okay? By the time they diagnose you with type 2 diabetes, usually half the pancreas is gone, the one that secretes insulin. Yeah, but Dr. Furman, Dr. Youngberg would say, and Mark Hyman would say that you can wake the pancreas up and get it functioning better if you start eating right. That 50% is gone, doesn't have to stay gone. But you can run a test to determine how your insulin is working, and I think that can be important. I mean, it could be totally dead. You need to be on insulin the rest of your life. They didn't invent insulin until 1920, yep. And the type 1 diabetic where the pancreas is dead, a lot of them died in intensive care. And before that, they fed them a high-fat diet, didn't they? 60, 70% fat. That was the diabetic diet, and it caused them to live a little longer. And then Banting and Best invented insulin, and those people in intensive care, we could get them. The trouble was, though, to me at Harvard, they actually taught them to eat sugary foods, and that 60%, 70% fatty diet went away. A mistake. And because what I'd like to encourage type 1 diabetics who might be watching this, if you eat a nutrient-dense, low-sugar diet, the amount of insulin you require every day goes way down, maybe 10, 15 units. I read it again the other day in the New York Times, like it was something new. I mean, that's something I've seen many patients do. I know a doctor that I think he had 10 units of insulin, type 1 diabetic, he lived to be 103.
Wow.
Normal in every way. So the type 1 diabetic, you can't just put in this insulin pump and then eat anything you want to and put more in the pump. Like I saw a teenager the other day, his mother, waitress, tell me about her son, and he would eat anything he wanted to, he just took more insulin, but the darn trouble is insulin does about 9 other things. It hardens your arteries, it causes dementia, it causes arthritis, increased rates of cancer. And so even a type 1 diabetic that doesn't make any insulin should eat a nutrient-dense way of eating. Very important, very important. The type 2 diabetic, the one that can occur, we see it now in teenagers, is not just adult diabetes, they used to call it, but now we know it can occur as teenagers. So teenagers need to have their blood tested starting very young. The biggest rise in being overweight has occurred in the 2 to the 6-year-old. Would you believe it? Have you read that?
Unbelievable.
Yeah, unbelievable. So blood testing is critical. Put in the results in your computer or maybe in a book, and follow your kid. Follow yourself yearly on a computer and see if the fats are changing, if you're developing metabolic syndrome or even before that, so you can take corrective action. And many times, you knock off 10% of your body weight, the disease is gone. Save your child, you know. And anything you'd like to say about children and obesity?
I think 1 out of 3, try to be more precise, I would say. 1 out of 6, I think, has already pre-diabetic condition in our country, the kids.
As a child, 1 out of 6. Yeah, 1 out of 3 is overweight.
Yeah.
Yes, that's what it is.
2 out of 3 is overweight.
2 out of 3 is overweight.
Yes. So
and then 1 out of 6 is pre-diabetic.
Yes.
And many of them had not been tested properly.
Right. Yeah. That's the problem.
Yeah, and that's a real problem, because they're going to die in their 40s and 50s and from unannounced heart attacks, strokes, increased rates of cancer. A lot of childhood cancer is related to type 1 diabetes.
Yep.
Yeah, I find out now probably 1 out of 2 in this nation, in this county here, are pre-diabetic, at least. And so get the proper test done. Sometimes the provider may not go along with ordering certain tests. We have noticed that.
Right.
You need this test, and like a gluten test sometimes, because gluten can do this too.
Right.
I saw a lady today who everybody in the family had a gluten problem, and her doctor refused to approve the gluten test. It's highly genetic disease. Okay?
Right.
which a lot of people don't know. They know that in Europe and Australia, but they don't know it here. And also I mentioned milk. Consumption of milk can be related to type 1 diabetes. Read Whitewash by Joe Keon. Read it yourself. Read it yourself. It's all about milk. And if you drink milk after that, I'd be surprised because milk, cow's milk is meant for baby cows. Our 5,400 mammals all make different milk, and our bodies react to it. Increased rates of cancer, increased rates of diabetes. Yeah, so to know about milk consumption is important.
Can I?
Yeah, tell me a story about one of your diabetics.
For the kids, if we do a regular sugar test, it could be normal, fasting sugar. Because they usually make a lot of insulin. Insulin is a growth hormone in that time. So they have a lot of insulin. So their fasting blood glucose could be normal. Their hemoglobin A1C, which is the 3-month test, will be normal. But if you suspect that this child may have prediabetes with their body shape and the weight and family history, you should check really insulin, and 2 hours after drinking that 75 gram of sugar to see what happened to the insulin level and what happened to the blood glucose level. Those people who are pre-diabetic, you'll find out that sugar is up, insulin is up. So by looking traditional test, fasting sugar and hemoglobin A1C, you're going to miss them.
What a great, so much for bringing that up.
This is very important.
Just to repeat a little bit, what we're saying, children just take, it's supposed to get a pot belly, and you get a blood sugar, and it's normal. That doesn't satisfy you. No. You need to maybe also get an advanced lipid profile test.
Yes.
Might show it.
Right.
But a test I particularly like is a glucose tolerance test.
Yes. Where
you swallow 75 grams of sugar, and then you check the fasting blood sugar and the serum insulin, fasting.
Yes.
1 hour, 2 hour.
Yes.
And then you can catch the abnormal pattern. You say, that child with a pot belly
you catch them.
You catch them
right there.
Teach them right. Eat a nutrient-dense food. The disease is gone. You probably added 30, 40 years to their life, and a lot less suffering in their life. So proper testing is critical, because I do see a lot of children that are overweight, and you look at the parents, they're overweight too. I was at Tabanaki table at a Japanese restaurant recently, and a whole family, I think God arranged this actually, the whole family, grandchildren, little children, was sitting there having a wonderful time, and God bless, but my eyes, I look at them and I could see, I think they were all diabetic, every one of them. They all had pot bellies, right down to the 4-year-old.
Right.
And they don't know it. Someone's not talking to them. Probably they need testing, correct how they're eating, and they could have a wonderful future. But again, who knows all the reasons? I'm just saying these things happen. If you have a relative like that, you need to bring it up. I was going to concentrate a little bit because I gave a talk the other day on dementia, Alzheimer's disease, they'll call it. A couple of good books to have a look at, and the point is, what's coming out now. A lot of people thought, these drug companies think, Eli Lilly spend $1 billion and trying to develop a drug for it. Well, the thing is, dementia, Alzheimer's disease, if you want to call it, it's doing many different genes. So the drug companies are working on, they spend $1 billion trying to find one drug. One drug ain't going to do it. But I tell you what will do it about this epidemic we think of dementia coming at us is related to insulin resistance. Yeah, a lady, 2016 from Yale, I think she was, she discovered an enzyme. It's called IDE enzyme. It is the enzyme that removes insulin from your brain, okay? And because if you have diabetes, the insulin level is high because you need sugar in there to feed the brain. The brain's a sugar, it needs sugar. and the IDE enzyme is the one that removes the insulin, okay? Well, all the IDE enzyme is used up, so it is not available to remove amyloid, the protein that causes dementia, that makes it sticky in the brain. Nerve conduction can't occur. Neurofibrillary tangles and amyloid deposits, okay? This enzyme is not available to degrade or remove the amyloid, and that is what causes dementia. It is now known. So if you can avoid type 2 diabetes, which we said you can get rid of it in a month, or if you're normal weight, exercise a bit, odds are you're not going to get it. You can avoid 75% of dementia. I mean, is this wonderful news? It's wonderful news, and we should be screaming it out. But this knowledge, most people I talk to have no living idea. They think this is an inherited disease, unavoidable. It's totally genetic. There are a few genetic cases of Alzheimer's disease, but the majority, 80%, 90%, are not. There are a few families where it's highly genetic, but they have gene expression. So if they exercise regularly, follow a nutrient-dense way of eating, like Dr. Furman describes, they are not going to get it, you know. And the other complications of diabetes, which are of course horrible, unannounced heart attacks, regular heart attacks, dementia, strokes, mouth disease. Queen Elizabeth, all her black teeth were black, yeah, from sugar, and teeth fall out much more because bacteria invade the teeth because they like the sugar. You're providing sugar to feed them. A lot of eye disease is related to the most common cause of eye disease is diabetes. Yeah, I have a friend of mine lost half his vision one eye, big time tennis player, from probably being pre-diabetic. Yeah, and his HbA1c was, just about in a pre-diabetic range. So he had metabolic syndrome, and vascular disease. I was trying to get these eye doctors because what they're looking at is diabetics most of the time, most of the time, to really concentrate on preventing the disease, but it comes from the family doctor, so it's been a difficult road for me. But vascular disease, glaucoma, cataracts, related a great deal to type 2 diabetes. Yeah, a lot of mouth disease, missing infected teeth, and then vascular disease all over the body is related. And vascular disease is the #1 cause of death in this nation. 1.5 million heart attacks, 500,000 deaths. Many other heart attacks are unannounced. You grab their chest and they die, for example. So we heard, I know many very successful people worth millions of dollars or big positions in government who are not doing much about their pre-diabetes or diabetes. So what do you think is going to happen? You know what I mean? I hope nothing happens. But to me, this is a national epidemic, so we need to attack it like a national epidemic, which I don't think is done. Most of the time, it just, here's your script, and life goes on. Let's try to prevent the disease, and then if you need the script, this is important. When you're dealing with people that are overweight, pre-diabetes, diabetes, how do you try to change them?
A good question. I think most of the part comes from basic knowledge. So I tell them that 70% of getting healthy is actually knowledge, and 30% is your effort. I used to talk about epigenetic effect. So a lot of people have this idea that we cannot change our gene. That's true. Structurally, you cannot change the function of the gene, but you can modulate the function of the gene. So if we have two mouse, they're twin, they have the same gene, what we find out, we expose one of them with a bad environment, such as bad diet and no exercise, that mouse become diabetic. On the other hand, the healthy environment will keep the good gene functional and will be healthy. So now that they have the same gene, but due to some reason the environmental effect actually start that function of the modulate the function of certain gene and then led to diabetes. Now, for example, that diabetic obesity mouse, let's get them pregnant. And during the pregnancy, we expose one of them with a good environment and another of them with an unhealthy environment. What we find out is that 75% of the babies of the healthier mouse will have a better outcome. They will be healthy. And on the other hand, during pregnancy, if you expose them with bad environment, 75% of the babies will be sick also. So they had looked at those babies' ovaries and testes, they find out that the same kind of genetic change. So what we call it is transgenerational effect of the lifestyle change in one generation is going to help you in the first generation, is going to go from next and next and next. So once you activate them with the knowledge, you say, well, what are the problem? You're eating bad food, you're not sleeping well, you're not doing exercise. If you start doing good thing, it's going to affect not only you, it's going to affect the
thank you. That explains really upon your genes, epigenetics, how what you do, what you eat, how you exercise will affect the next generation.
Yes.
And you picked up some of that from your past generation. So you're not only making your children healthy or unhealthy, depending on what you do.
Yes.
Yeah. A very beautiful explanation. That's genetic expression.
Right.
And we have what are called telomeres, end of our chromosomes, can be affected by our activity. And children at birth have expressed very little of that genetic structure. So your lifestyle is critical. So in summary, what are we saying, Dr. Ahmed and I saying today is you can avoid most chronic disease, about 70 of them, by proper lifestyle, by eating nutrient-dense diet, foods of color, their interaction of the vitamins, the minerals, the phytochemicals, make you healthy, exercise, 30, 60 minutes a day is helpful, and you can be very healthy, live to be 100. That's our plan. I hope it's your plan. Thanks for watching the show. Namaste.
Namaste.
And we're on every week. We'll make you knowledgeable. I hope you read some of these books, because as Dr. Ahmed said, 70% is knowledge, 30% is what you do. Thanks so much.
Thank you.
And namaste. Yeah.